Hey, welcome to Health Fact Friday. My name is Dr. Nilsson. This is Camilla.
Hey.
So today we want to address a question that we've been getting quite often recently with some of our low back pain patients. Camilla's been getting this on the phone as well as I've been getting it in the treatment room. Camilla, go ahead and tell them what the question is.
The question is, how do I know I really need a spinal fusion?
So how do I know I really need a spinal fusion? So there's two different areas you'll typically get a fusion. It's going to be in your neck, or you could get a fusion in the low back, the lumbar spine. Most often we see people who do get it, or are told that they get it in the lumbar, the low back spine. So the question is, how do you know when you need it? So first, I would ask you, tell me when the pain started. So was there a traumatic event? Was there some sort of injury? Was there a car accident? Did you get hit? Was there any sort of real injury to the onset of your symptoms? Or did it just come on gradually? Mm-hmm. Because a lot of the people that we see here in the clinic, pain comes on gradually. And it's not that they can necessarily point to any one instance when the pain started. When pain comes on gradually, likely you don't need a spinal fusion. People will show, if you take an x-ray or an MRI of somebody's spine, the older that we get, the more likely we are to see something scary on the image. So that can come in the form of degenerative disc disease, herniated discs or bulging discs, arthritis, spinal stenosis. Now, oftentimes when they're going to start recommending a spinal fusion is when you have symptoms of weakness in your legs, symptoms of tingling down your legs, tingling, burning, some people will say pins and needles, numbness, or weakness. Those are going to be the symptoms that you have. And they should be in both legs, not just one leg. If they're recommending a spinal fusion, you should have weakness, tingling, numbness, burning down both legs, and there should be some sort of traumatic event. Mm-hmm. Because oftentimes when the pain comes on gradually and over time, it's actually something else where the pain is coming from. Now, we typically see, and you know this, Camilla, is we typically see people that come in with these symptoms, it's actually a hip problem. Mm-hmm. It's not even a back problem, even though you see something on the x-ray or the MRI, such as spinal stenosis or degenerative disc disease. That can be there, and usually it's not causing the symptoms. Research has shown us time and time again that people without any pain can show herniated disc, bulging disc, degenerative disc disease, spinal stenosis, arthritis. It's natural aging. Just like we age on the outside of our body, we age on the inside, and it comes in the form of those on an image, and it's usually not causing any pain. Did I answer everything?
Yes. My question is why we should avoid having or have it as a last resort.
Yeah.
Fusion.
So why should you avoid having a fusion? Well, first off, surgery is not always going to fix everything, even though we would like it to. Back surgery has honestly been shown time and time again that it is one of the most unsuccessful surgeries performed of anywhere on the body. And then on top of that, a spinal fusion, what that does is pretend this is the spine right here, and I fuse this so that the bones typically would be able to move. Mm-hmm. As you bend forward, bend backward, rotate, they'd be able to move. But if I fuse it, now they can't move. Our body's great at compensating, and honestly, the far majority of pain is due to a compensation somewhere in the body. But what happens is if I fuse the bones here and they can't move, now I've got to get the movement from somewhere else. Mm-hmm. So now I'm forced to get the more mobility from above the fusion or below the fusion. And now those areas become hypermobile. And at some point, typically those areas start to hurt. And then one fusion leads to another fusion. Oftentimes somebody that has one fusion will go back in years later and they're told that they need another fusion for the area either above or below. So a lot of times it's not a long-term outcome, or it's not the long-term outcome that people want. And usually it can be avoided. Science and research has shown that lumbar fusion most of the time is completely unnecessary. And there's ways to go, like physical therapy, for example. You can avoid it. Most often you can avoid it, especially if you say that there was no injury for when my pain started. That's the person that can almost always avoid a spinal fusion.
Right, because I hear many patients calling that I have 2 or 3 spinal fusion, and it's like, it's surprising to me that you go for one and then go for more.
It is. I mean, typically people that get 1, they end up getting 2, or even 3. And then they don't get the outcome that they want. Again, the tingling, numbness, burning, usually that's coming from somewhere else. It's not even coming from the spine. It's usually coming from the hip, or it could even be, it can come from the back, but it's usually muscular. And that's not something that you can see on an X-ray or an MRI. If there is weakness, if there is true weakness in the legs, you should definitely get that looked at, because that can be a sign of irreversible nerve damage that's going on. So if that's something that you're suffering from, definitely find a specialist for you. If your pain came on gradually over time and you've been told that you need a spinal fusion, please reach out to us. We do offer a completely free discovery visit where you come in and sit down and talk with myself and tell me exactly what's going on. You know, questions such as, when did the pain start? How long has it been going? What have you tried to fix it? What makes it better? What makes it worse? These questions start to identify where the root cause of the symptoms are. And then we'll take you through a full body movement assessment, be able to see what movements are painful, what movements make you feel a little bit better, what areas aren't moving the way they should. And that will complete the story of really where the root cause of the pain is coming from. And then third, we lay our hands on you, because once we can lay our hands on you and find what areas are painful, what areas are tender, what areas are tight, and then a lot of times muscles will refer into other areas. So I see time and time again with patients who have back pain, but their hips, the muscles in their hips are actually referring pain into their low back. And so if we work in those areas, they start feeling pain into their low back, which is the exact area that they're complaining of symptoms. And so the area that hurts oftentimes isn't even the problem, and you hear me say that all the time. Yeah. It's not. It's usually not the problem, and we're great at compensating. It's usually coming from somewhere else. But if you've been told you need a spinal fusion and you would like a free second opinion, we do offer those. Give us a call here in the clinic. Phone number is 919-617-6134. Or you can always go to freeptvisit.com, freeptvisit.com, fill out the quick form, and we'll reach out to you and we can set that free visit up for you. Thanks so much.